A very good day to all my fellow lecturers. My name is Tibanithan Analaki Subramaniam. I'm from MLS 11. My supervisor's name is Madam Norhatia. Uh, Today I'll be presenting on my poster on my thesis entitled of Performance Evaluation of 6max XN1000 and Beckman-Coulter DXH 800 against blood hemolysis for full blood count parameters among dengue patients. This thesis I have actually conducted in my working place itself, which is the Gribbles Pathology, located at Sentosa Specialist Hospital, Klang. The abstract from my thesis is, full blood count test is an essential test that all physicians will do to treat patients, especially dengue patients, to monitor certain parameters such as HB, PCV, white blood cell, and platelet. These are the most crucial parameters, and false results can lead to misleading the treatment of the patient that affects the patient care value as well. Currently, the study shows on how hemolytic samples can affect on the reading of dengue patients among two different instruments between GXH 800 and 6max XN 1000. The samples are collected from patients. Left aside, evaluate the level of degree of the hemolysis, and the sample is run on both instruments. The main reason why I choose these hemolysis samples with a dengue patient on full blood count on two different instruments is to get a clearer vision to all the physicians, especially that I'm working here back in this hospital, so that they have a clearer vision that what is hemolysis and what does hemolysis affects, because most physicians, they are not aware on the effects and what are the consequences of a lysis sample that can affect on the patient results. These are the main reason why I have choose this particular topic. Especially, it's a very abstract. It's a very open topic, so that I hope it will get a clearer vision to all physicians and also all my fellow mates as well. Moving on to the introduction, overall topic on my thesis is related to hemolysis. So what is hemolysis? Hemolysis is a destruction of or rupturing of red blood cell that can occur due to some factors. Basically, lyse sample can cause interference in patient's results, whereas different instrument has their own specification and bias level on sample condition that are acceptable within the specified limit, and on the research it makes physician to understand that hemolysis samples plays an important role in producing a good and quality results. Next will be the objective. The main objective of the thesis that I'm doing is to evaluate performance of DXH 800 and XN 1000 against hemolysis of full blood count test. Next topic will be the methodology, whereby the methodology sampling collection, where 150 samples of dengue patient have been collected, and I've included I have divided into the inclusion criteria and exclusion criteria for my thesis purpose. The inclusion criteria will be the freshly collected samples and hemolysis samples, and also volume at least 2 ml to 3 ml. Whereas the exclusion criteria will be clotted samples totally will be rejected. I won't be using for this particular thesis. And then second is insufficient volume of sample and wrong tubes. Upon collecting all the samples in EDTA, and it's set aside so that all it settles down and we can evaluate the degree of hemolysis, and it will be according to its category, will be divided into its category, and all the samples are run in 6max XN 1000 and DXH 800 within 4 hours of after the sample has been collected. And then a normal sample, if there is any normal sample which is non-lysis sample, I would run that, and that particular sample will be as my QC control, will be my QC, so that I can compare with the how's the other results for a lysis sample comparing with a normal sample. Upon running all the samples in both instrument and all the data are collected, and I have used the SPSS for data analysis for the evaluation of the full blood count test results using two different instruments, is to compare the concentration of the hemolysis sample with a non-hemolysis sample. Next will be the results. where based on the conclusion that I received after collecting all the data, which is the test analysis was used, p-values is less than 0.05 were considered statistically significant. How the data has been collected is I have divided into two, which is one is for the XN1000 instrument data and another one is DXH 800 instrument data. And I've actually divided in the sense of using a normal sample, which is a not lysis sample, as my QC and as the data has been collected, and the level of degree have been differentiated in 1 plus, 2 plus, 3 plus, which is the depends on the severity of the hemolysis. And then it's the desirable bias and clear. Clear means it's clinical laboratory improvement amendments of 1988. This was been taught by one of my HODs in hematology department, that we use this clear, it's to have a range of the acceptable bias that is produced by the machines itself. So, for example, for XM1000, I have divided into the parameters, which is the RBC, HB, PCV, HCT, MCV, MCH, MCHC, and platelet, and the results are more significant uh, when as the lysis increases. For example, for RBC and HB, comparing that a normal sample, which is a non-lysis sample, according as the level of hemolysis degree increases, the results is also increasing. It doesn't affect much for HCT, which is known as PCV, MCV, and MCHC, and MCH. It also affect platelet a lot. Same goes to XN and DXH 800 as well, where I have divided into a non-lysis sample, which is my QC, and then the level of degree for 1 plus, 2 plus, and 3 plus, which has its own desirable and clear, which is, as I mentioned earlier, taught by my HOD. Upon tabulating and resulting in my results, it shows that HB, RBC, and platelet have a very drastic bias upon running a lyse sample. So the discussion is an analytic hemolysis interference occurs when the constitution of plasma are at a lower concentration than the constitution in erythrocytosis. The release of erythrocytic constitution can result in an increased value, as as how it has reflected in my results for RBC, HB, and platelet. Okay, and then cell constitution at a higher concentration of HB, RBC, and platelet enters the surrounding plasma when lysis of erythrocytosis occurs. As expect as per expected, in the current study, these values shown clinically meaningful increases. Therefore, we can say that even if a microscopic invisible hemolysis occurs, we can say that HB and RBC and platelet uh, will be resulting in a higher value. On the conclusion, I can conclude that this study that lysis sample affect plasma concentration of whole range of full blood count parameters, where it has a prominent effect of hemolysis is observed especially for HB, RBC, and platelet. For other analyzed differences were statistically significant as well, but it's remained within the clear limits. Overall, would recommend the severe degree of hemolysis new sample should be requested, meaning the pre-analytical are very important, and even the physician should take note on this. Although it's a time consuming, but this procedure is highly useful since it may help to avoid unnecessary rerun of samples and reduce the cost as well. It reduces the cost for like reagent buying and so ever. That's it for my poster presentation, and finally I would like to send my regards of acknowledgement, and I would like to express my gratitude and apologies to my supervisor, Madam Nurhatia, and for her guidance, patience, and most importantly for providing motivation and warm spirit, and my uh, throughout the hurdles that I've gone through for the past 1 year, and I had to defer for my thesis as well. I would like to really thank to her, and also I would like to thankful to my parents, my family members, who has been constantly a motivational support. And I think without both of them, without Madam Hatia, I would not reach to this level. And thank you so much, and thank you again. Thanks.